good afternoon. I can tell you that it's not easy to just snap your fingers and move somewhere else, but if every American had the ability to leave from where they are to come to Naples, many would do it. I can tell you that. It's a great place to be, and we're really glad to be here at Premier Place at the Glenview, which was recently awarded a Gold Seal Award for Excellence in Long-Term Care. So thank you for doing that, and we know how important it is. And yeah, clap for them. We've got a great group of folks here today. We have our Secretary for the Agency of Healthcare Administration, Secretary Simone Marsteller. We have the Surgeon General of the state of Florida, Dr. Joe Latipo. We have our, yeah, clap for him, he's good. He's not officially, but maybe they'll make him a contributor to Tucker Carlson's show soon. We'll see. Does a great job on all his appearances. We have our incoming Senate President, our great senator from here, Kathleen Passidomo. And from North Florida, who was actually with me yesterday doing an announcement right basically on the Florida-Georgia border we were at, and is now down here covering the entire state with this bill that we're going to sign today, Representative Jason Schoaf. So I want to thank him for doing it. And then we also have from Miami, Senator Ileana Garcia, who was one of the sponsors of this bill, and then two local representatives, Bob Rommel and Lauren Mello. So I want to thank them for their hard work. And then we have two folks who are going to speak about the importance of what we're doing today. We have Lieutenant Colonel Doug Madigan and Charlene Miranda, and they're going to share their stories about the importance of what we're doing here today. I mean, I think if you look back over the past 2 years, one of the most heartbreaking elements of this was shutting people out of being with their loved ones at really critical times in their lives. And we worked very hard to make sure that in long-term care facilities we had visitation. I think we were the first state in the country to do that, almost 2 years, I think it was August of 2020. We worked very hard with our hospitals to tell them, yes, I understand you're trying to mitigate COVID, and that's important, but you can't just shut out all these human interactions for people who are in the hospital and have really difficult circumstances. And I can tell you, if you take people and they have that connection and they have loved ones with them, they are more likely to recover. Don't tell me that that's not true. And so you can't just shut out every type of human interaction because you're dealing with a respiratory virus. There's nothing wrong with taking precautions and they want you to wear PPE, but to not let somebody be there with their loved one, end of life situations, to lose a family member and be shut out of being able to go into the hospital, that is fundamentally wrong. To have other instances where you have people that are going to get treated and to not have a spouse or a parent, this is really, really difficult. And yes, obviously there were people that were hospitalized for COVID. There's people hospitalized for many other things, and yet they were not allowed to have people in many parts of this country for a long time. And so I think most of the hospitals in Florida, most of the long-term care facilities have tried to work constructively to do that. But we understood that, look, COVID is never going to be eradicated from the earth. That's just not the way it is. These viruses circulate. It's going to become it's going to be an endemic virus. And I think a lot of people have had it, and there's a lot of protection out there. So hopefully the clinical impacts are going to be less as we go forward. But it comes and goes in waves. There's times in the south over the summer. In the north, you have big waves in the winter. And we don't know how that's going to go. But regardless of that, that cannot be used as a justification to separate loved ones from each other, to deny somebody who's in the hospital the right to have their spouse present or their children present. And so we thought that we needed to make sure that Florida was leading the way on this to protect patients' rights, to make sure that as somebody who, if you're hospitalized or you're in a long-term care facility, you have the right to have your family members present with you. And we have to stand up and say that. And so Actually, under the Trump administration, they relaxed, they had suspended visitation in nursing homes, and then they put that back in 2020. We obviously did that even beforehand. We were ahead of the curve. But you know, HHS and the federal government, they've yet to reinstate visitation protections for patients in hospitals nationwide. And so you usually have protections. They're not as strong as what I'm going to sign into law today, but they're usually as federal protections, and they have basically suspended those protections. And so you have some parts of the country where people still aren't able to get in and see their loved ones in these certain circumstances. And so what we're doing here today is underscoring and solidifying in Florida law these really significant rights for Floridians. And so the bill that we're going to sign today is called the No Patient Left Alone Act. And it increases patient protections and ensures Florida families have a fundamental right to visit their loved ones receiving care in Florida hospitals, hospices, and long-term care facilities. The bill bans facilities from requiring visitors to show proof of COVID vaccination. You know, there's some places that, you know, people have COVID, they have immunity, so they're not getting vaccinated, and then they're being denied the ability to go into these places. Meanwhile, you could have other folks who have not had COVID, and their protection isn't even as strong. So we wanted to make sure that was good. Also, policies cannot prohibit physical contact, such as hugging between their loved ones. They would actually police this, where you go in and you said, okay, you may be able to go, but you can't give your wife a hug, or you can't give your kid a hug. I mean, give me a break. And so we need to be able to protect that. This ensures families can be there and patients can have their support system around them when it matters most. And I want to thank our First Lady, my wife, for all the work that she did to get this bill across the finish line. You know, we've, over the last 6 months, experienced this firsthand. And I was, you know, I would go with her to her chemotherapy and when she was in the hospital, and you're there. And I can tell you, if I had not been there, it would have been more difficult for her. I mean, you know, you need to have the people that you love there with you. And so we were fortunate to be able to do that. But I think that should be the expectation, you know, that you have that. And then if I mean, just imagine, like, we have young kids. I mean, what, you're not going to let both the parents in to be, if you have a kid that has a problem? So this is really important, and I know that this was something that was really meaningful for her, and I think that she did a really good job. But isolating people is not healthy. That is not the right thing to do, and making sure that we're facilitating the connections that really make life worth living is something that's very, very important. And you have these situations, even if it's more of a routine hospitalization, just the fact that support system's there means an awful lot. And then, of course, you know, we do have these situations where someone comes to the end of the road, you have an end-of-life situation, and to be able to have all the family present, to be able to say goodbye, that is so meaningful, and to deprive them of that is really, really bad. And so that's not going to happen in the state of Florida, and I do want to say we've had a lot of hospitals that have really worked constructively with us on this, because I think they understood how significant this is, and I think it's the right thing to do. I also think, just from a healthcare perspective, you know, I think it does lead to better outcomes to have this support. You got enough going on when you're in the hospital for something, and the last thing you want to be is just sitting there wondering where all your family is and be lonely and isolated. So this was a good bill. This is a bill that I'm really proud to be able to sign into law momentarily after we hear from some of our folks, and I hope that the federal government will reinstate the protections federally that they've. I mean, it's been 2 years now with this, and the idea that you still have some families that will not be allowed to be together at these critical moments anywhere in our country is a real sad commentary on the state of affairs that we see. So Florida's not going to be denied that. We're going to make sure that we're fighting for our patients. Okay, I'm going to put the John Hancock on the bill, and we'll make it official. Today is April what? 6th. 6th? All protecting patients' rights.